Okay, do you hear me? Yeah, that's fine. It's a really nice pleasure for me to be here, and it's my first time in Doha. And I would like firstly, of course, thanks very sincerely Rodney, Hakim, and also Sebastian, who is somewhere, for their kind invitation to participate in this recovery symposium. We have previously organized a big also symposium on recovery in 2009 in Paris, where Shona was here. And I really agree with Hakim saying that it's kind of starting point or a key point on something in order to create a very interesting group about the recovery process and how to improve performance. Today my talk will focus especially on the whole body cryostimulation or cryotherapy. We can see the difference maybe during the coffee break. And including the recovery strategies in sports. And also, of course, the lesson learned from research and practice at INSEP. INSEP is the French National Institute of Sport in Paris, and since 2009 it has been completely renewed, and now a large part is devoted to recovery, and up to 600 elite athletes use actually the 5 new recovery centers. As introduction, recovery is one of the least understood phenomenon, and there are only few studies on the exercise adaptation cycle. And we all know that athletes spend much more time in recovery than in active training. And the question is, my first question is, can enhancing recovery improve performance? That's the reality of the field. And in this context, recovery must facilitate adaptation to high training loads. It means if it's the time or appropriate time to induce a recovery mode or not, sometimes we don't need recovery. Must decrease risk of overload. That is really important. Overload, when I say overload, it's all the states from overload to burnout. And also to reduce the risk of injuries. And, which is really important, must improve the readaptability of performance. Coaches and athletes are faced with a new challenge. They have to use recovery into their training program because recovery is a multifactorial approach. It means that from practical application perspective, we define recovery as a whole set of processes that result in an athlete's renewed ability to reach or exceed a previous performance. And furthermore, the recovery period is also defined as the time necessary for various physiological parameters which were modified by exercise to return to resting values. But for the topic of today, who is interested in cold treatments? First, you can see on this picture the Scandinavian elderly people named the winter swimmers who used to swim every morning in ice water in order to increase the antioxidant status, for example, or increase the immune system. All the Finnish studies, not only sports scientists, but scientific people, work on the winter swimmers, and we have got many, many data concerning the effect of swimming in ice water and increase of many physiological adaptations. And secondly, the snow swimmers, a kind of ridiculous race. Snow swimmers are some amazing Finnish champions who used to swim in the snow, and it still exists, and you can see many videos on YouTube as well. And just after, if Bears taught us how to use cold, the French judo Olympic champions, Teddy Riner, whatever the link he has with the bear, used to, or is really familiar with cold treatment to speed up recovery. And he said specifically before the Olympics in July, cold therapy as recovery helps me to train harder the day after a tough session or tough training. That's really important for us to have the feeling of the athletes before and after a recovery modality. Then the training recovery cycle could be the following. You have to do the workout, then you feel sore a little bit, you are unable to complete the next session, but you have to do the next workout. You use recovery therapy, you feel less sore, and then you are able to complete the next workout. You think personally that recovery therapy must work, and then you do again the next workout. That's just the recovery adaptation cycle. Then call it at the intersection between the contextual and the scientific elements. And firstly, at INSEP, the coaches believe in the use of techniques to cool the body, with high interest also on the athlete very recently, since about 2009. It's very recent. And also on the market, we can have more and more new transportable techniques, which are very useful, and I can show you some, of course. And now there are more and more competition, like in Qatar, in Doha as well, which take place in warm and humid conditions, which is very deleterious, of course, for performance. And concerning the scientific part, the cold exposure is mostly used to speed up recovery and treat muscle damage and inflammation as well. Then a number of techniques are traditionally used to cool the body, such as cold towels, the cold water immersion, the cryotherapy sessions, the drinks also, like high slurry for the nutritionist, and also for example, the application of ice pack. And today, I will focus my talk on the exposure to cold air through the whole body cryotherapy, and one study on ice jackets as well. Then my presentation outline will focus on INSEP'S studies only, and the first part of my topic will be devoted to acute recovery, and the second part will be devoted to chronic recovery, but due to the lack of time I have, I think we can just discuss about overreaching and daily use of recovery during the coffee break as well. There are 3 different room temperatures, for example, the one we've got at INSEP. And we've got -10, -60, and -110 degrees. Then you have to go first in the room at -10, then in the room at -60, and you stay for 3 minutes in the one of -110 degrees, very cold and dry air. It's not really pleasant, but we know that it's a little bit efficient. And the other WBC technique you can see here, even we lost yesterday, it's cryotherapy we name tank with very cold air based from expanded nitrogen gas. In this second technique, the whole body except the head is exposed to cold, of course, and we call it the partial body cryotherapy, the PBC. The WBC was originally used in 1989 in Japan for especially inflammatory and also skin pathologies, and more recently in 2003 also used in Poland for alleviate all the depressive symptoms, which is a very, very nice study. And now, after it was used in sports medicine since about 2000 to enhance recovery after injuries and surgeries. And now it is used to speed up the recovery in sports in order to alleviate all pains we can have, decrease inflammation, increase the antioxidant status as well, and maybe reduce also the delay onset of muscle damage, named DOMS. Here you can see the distribution of WBC session per pathologies at INSEP in 2012. For example, you can have the ankylosing spondylitis, about 23%. For pain, it's 24%. Tendinopathy, about 10%. And 4% only for recovery. It's a very low value. Concerning the elite athletes who prepare the Olympics, about 2,050 athletes have done at least one session in a year, and some about 35. We've got the distribution like the following: about 31% for fighting sports, technical sport, aesthetic sports about 18%, team sports and high energy demand sports about 43%. Let's speculate a little bit the first impact of the WBC. The first one, of course, it's the thermal shock due to the cold chamber. And then there is a decrease in temperature and inducing a vasoconstriction and stimulation of cold receptors. And the autonomic nervous system will be then stimulated, especially the catecholamines and for sure the noradrenaline, which have a real incidence on the muscle pain. In response to the peripheral vasoconstriction, the blood volume will focus on protecting the core, and consequently stroke volume and blood pressure will increase, increasing muscle blood flow by vasodilatation mechanism, and also for sure the muscle oxygenation. Finally, the muscle pain and muscle damage will be reduced, and as a result the recovery should be improved. To speak about practical application, that's also the aim of this symposium. Let's have a look first at the results, the basic results of the studies we have. Our first study focused, very interesting but very easy study, focused on the effects of exposure to different cold temperatures on skin temp and catecholamine responses. On this slide, you can see 4 subjects before and after 3 minutes exposure at minus 110 degrees. With, on the right-hand side, you can see here from 0 in black and 35 degrees in red color. Obviously, immediately at the end of the 3-minute exposure in minus 110, minus 60, or minus 10 degrees, you can have the average of the thermograms, means the whole body temperature, skin temp. And we've got minus 14 degrees after the minus 110 degrees, minus 9 degrees after the minus 60 condition, and after the minus 10 condition, you've got a decrease of minus 4 degrees. And after 20 minutes, you can see that for the minus 60 and minus 110 condition, in fact, all values are still lower, which is really interesting if you would like to think about for the pre-coding strategy. And we've got actually 2 studies running about pre-coding using the WBC as well. Concerning the noradrenaline, for example, only 3 minutes cryostimulation seems sufficient to trigger sympathetic stimulation thanks to the increase of the noradrenaline responses. And it's there is an effect for minus 60 condition, but it's more pronounced with a minus 110 condition. In a second study, surprisingly, when we compare the PBC to the WBC, we showed that this system, the PBC system, is also a good system to increase the sympathetic activity through the noradrenaline stimulation, as you can see here. We've got approximately the same values using the both. And we are a little bit surprised because the head was outside in the tank. Heart rate decrease in both systems. For PBC and WBC, minus 6 and minus 10 beats per minute, respectively. And also, if we have a look on the index of parasympathetic activation, we've got approximately the same value. It means an increase of the RMSSD. And finally, only the WBC induced an increase of the systolic and the diastolic pressure, maybe due to the cold stimulation itself. To conclude, the main results indicated stimulation of the ANS with a predominance of the parasympathetic tone. There is also the increased systolic blood pressure with sympathetic stimulation. As a result, there is sympathetic activation peripherally and parasympathetic activation of the core. That's it. Let's go for first the practical applications. WBC and PBC as a parasympathetic reactivation seems appropriate with the decrease in heart rate and increase in ASD1 or RMSSD. There is a greater benefits when stimulus includes head and neck. It means WBC condition. And PBC can be more easily used on the field or during competition. It was the case during the last Euro 2012 last year, and also since now 2 years during the Tour de France. And now concerning exercise, the question is why using cold in post-exercise recovery? And the state of the art say many things about it. And let me sum up a few studies. A decrease, for example, of the pro-inflammatory action, reduce the release of intramuscular enzymes, decrease the delay onset of muscle soreness, limit edema development, improve sleep, limit depressive symptoms, and then increase the antioxidant status. In 2009, we conducted the first study combining the exercise-induced muscle damage and WBC as a recovery method. We tested the effect of 3 different recovery strategies, including the 3 minutes exposure for WBC, the passive 30 minutes, and the fair infrared method doing 30 minutes at 45 degrees exactly. And within 48 hours of a simulated training race, where the athletes have to run 3 minutes uphill, 10% slope, and then 3 minutes downhill, 15% slope, and then on the flat treadmill, 3 minutes, and then repeat it about 5 times. As expected, the results indicated a significant decline in the MVC, maximal voluntary contraction, following all the running sessions, but less significant than in longer ecological races, for sure, only 10%, and we can see that after a large trail race in ecological versions, we can have about 30%, but we've got only 15 minutes as eccentric contraction protocol. The first interesting finding was that the MVC was recovered after the first WBC session. It means post 1 hour. And while it took about 24 hours for the fear modality and was not recovered at all during the passive recovery, then we can just have a look on these results, really interesting one. Concerning maybe psychological process, even I'm not really a psychologist, perceived sensation of pain, tiredness, and well-being were also significantly modified by the fatigue. For example, the pain was removed after the first WBC session, while it took 48 hours with the fear and was not recovered with the passive modalities. Concerning the tiredness, was also reduced after the one WBC session, and when compared with the other modalities, not recovering. And the well-being was also restored earlier using the WBC compared with the other modalities. And WBC was then an appropriate recovery strategy to lower the DOMS, thanks to the beneficial effect of cold reducing inflammation and also the nervous activity. To sum up, this is the first study analyzing the effect of WBC versus fear versus passive modalities on recovery from exercise-induced muscle damage. And WBC induced to recover the MVC 1 hour after exhaustive exercise and decrease of the pain and the tiredness. However, there is no incidence on the CK levels, whatever the situation. In the study number 4, we replicated the simulated 48-minute running race, and we analyzed the effect of the WBC on inflammation parameters. As you can see on the graph, if you have a look on the IL-1 beta, which is a pro-inflammatory interleukin, was significantly increased 1 hour after exercise, but only with the passive recovery. It means that the WBC just allowed to have a kind of steady state of this IL-1 beta, while the IL-1 RA is an anti-inflammatory interleukin, increase very significantly after only one session of 3 minutes exposure at WBC, revealing a significant effect of WBC reducing inflammation after a single 3-minute exposure. There is no more effect recorded over the week. It means that a unique WBC session should be sufficient to reduce acute inflammation after exercise. And we have many interleukin parameters, and all the cytokines have the same results finally. Typically, after strenuous exercise, there is an imbalance between the pro and the anti-inflammatory mechanism, which is also the deal with the physiological adaptation, should we do recovery or not. In a passive condition, the IL-1 beta is accumulating with other spaces like IL-2 or TNF-alpha, for example, and which its specific receptor to be activated and to produce the inflammation. After only one WBC exposure, the anti-inflammatory IL-1RA reach the same receptor to inhibit the pro-inflammatory action, and therefore WBC seems to be effective in order to reduce the inflammation. Then we observed a decrease in synthesis of the pro-inflammatory interleukin, a decrease also, very interesting results of the CRP with ARG in a systemic way, an activation of the anti-inflammatory interleukin, an increase also for the neutrophil counts, which is interesting for the immune system. We'll link also with nutrition as well. And then finally, the cold induced reduction of inflammation and also the recovery time. Practical application could be the following. One session of WBC can program to maintain fourth generation after severe exercise. And after sports, when we want to improve perceptual recovery, it means better well-being, better DOMS, less DOMS, and less tardiness as well. It seems beneficial for all sports involving muscle damage and also eccentric exercise, of course, like many team sports. More recently, we have studied the effect of additional cooling strategy that can be used directly on the field, such as ice jacket and cold water immersion, but in a temperate environment, which is really new. But it's a little bit risky because sometimes we don't have any results if you take some risks. But never mind. Let's go for the protocol. After 15 minutes warm-up, the subjects perform 2 45-minute cycling exercise at 60% of Pmax. And then we've got 25 minutes recovery when the vest, the immersion, and the passive condition were applied. The sweat rate was less significant when in this condition, in this immersion condition, during the recovery, and compared to vest and passive condition. We also observed the lowest lactatemia for both the vest condition and the immersion condition compared to the passive condition. And the immersion condition was also significantly lower compared to the vest one. However, the cold immersion, which is only 20 degrees, it's not really cold, but that's the name, due to the cold and the hydrostatic pressure as well, induced significant blood flow, which allow the clearance of byproducts somewhere. Concerning the cryovest, there was little change in the heart rate, only 2 beats per minute, and only 8 liters per minute for the expiratory flow, which is really linked also with the steady state of the oxygen cost of exercise, which is really important because you can spare some energy if you have to do a maximal subsequent exercise after. Very shortly, then to sum up this study, but you can have a look on the paper for sure. There is a decrease in thermal load like T-core and T-skin, decrease in lactatemia after 90 minutes exercise. Concerning the vest, we've got a decrease of T-core, oxygen uptake, heart rate, and minute ventilation at the end of exercise, and also a decrease in lactatemia post-exercise compared with the passive condition, it could be interesting also as pre-cooling method. Practical application from the study number 5 could be the following. The immersion seems to be more effective as post-cooling method and reduce T-core and lactates when used during half-time of exercise. That's my feeling. Ice vase can be used as pre-cooling method and or during half-time, like team sport, maybe football, of course. As a case studies, players used in the ice vase during the Euro 2012 also in a hot condition, but you can remember that 38 degrees and 88% of humidity in Donetsk. And it seems also efficient in thermal environments because it preserves the natremia. And the finally, the cold intervention such as ice vase can provide sufficient reductions in thermal load and physiological constraints when subsequent exercise have to be performed, whatever the environment condition. The last study concerning the acute recovery was conducted in synchronized swimming in the French team, the elite French team. They trained about 7 hours a day. So coaches finally came in my office and say that we would like to optimize recovery for the athlete without decreasing the volume and the intensity. That's a new challenge for me. Then I accept, but I say, okay, but we have to do some research with the team, of course. And there is many things, in fact, with this team. And the context was the following. In fact, there is too closely scheduled maximal exercise boot because it's the reality of the competition. And we have to evaluate the effect, for example, of 4 modalities recovery. And then we compare the effect of 30 minutes active recovery, which is mixing one with 15 minutes swim and 15 minutes synchronized, because that's the reality of the field. The whole body cryotherapy, 15-minute contrast therapy, 1 minute each cold and hot, and 30-minute passive recovery. And all parameters have to be confront to metabolic indicators first, and also to post-exercise parasympathetic reactivation or not. They first swam 40 meters and 100 meters to assess VO2 max and also the maximal speed. Then the swimmers perform 4 trials at random on the same day, each week, at the same time of the day. And during each trials, swimmers perform their competition ballet twice, named B1 and B2, and with a 70-minute recovery, and they followed the 4 recovery modalities. We then measured heart rate variability, blood lactate concentration, blood gas, before and after the B1 and B2, and also the peak oxygen consumption at the end of the 400 meters, but also at the end of B1 and B2, using a retroextrapolation system. The lactate clearance was significantly improved here with the active modality, and not missed, not far, with the WBC compared to passive trial. However, the contrast therapy did not differ significantly from the passive condition. Both active recovery and WBC led to a significant increase in the oxygen uptake. Compare the post-B2 with the post-B1, and which were observed in every swimmer. And VO2 peak was maintained here in the contrast therapy, while the passive condition led to a decrease in VO2 peak, again observed in every single swimmer. Looking very quickly to the HRV analysis, each body caused a significant decrease in vagal-related HRV variables. There was no difference between post-B1 and post-B2, whatever the situation. WBC showed, however, a large increase in indices of parasympathetic activity compared to baseline at pre-B1. Here you can see there is an increase about 200% of the RMSSD using the WBC treatment. In the context of closely scheduled maximal exercise, the whole body cryotherapy appears to be as effective as active recovery regarding the metabolic parameters. Active recovery might be, of course, more practical and accessible, especially when time is short, and also in competition, because we don't have the WBC most of the time in competition. And both appear more effective than the contrast therapy, which in turn is to be recommended over a simple passive recovery. It has been recently reported by Hani and Martin, which are here today, that a daily use of cold water immersion increase the resting RMSSD and also the sleep quality in swimmers, which is really interesting finding, I think. In the light of this finding, the question is, can WBC improve recovery and prevent excessive fatigue accumulation over a period of intensified training? That's really important. That means, what about chronic recovery? And maybe I can show you the last study and we can have the appropriate answer. For the last study, I would like to introduce this one, saying that intensified training can result in a decline in performance. That's the reality. And the short-term overreaching can be called functional overreaching. The main markers of overreaching has been recently presented by Romain Meusen in a joint consensus published in the ACSM and ECSS. And if you are interested, you can read this paper, very interesting one. And the gold standard includes the decreased performance, the high perceived fatigue, the perturbed mood disturbances, and also sometimes an associate higher prevalence of risk of infection. In this last study, we investigated the effectiveness of daily WBC session as post-exercise strategy during periods of intensified training in the same population by using a chronic recovery method. Firstly, we investigated whether daily WBC use during intensified training periods could prevent the early physiological signs of fatigue accumulation, such as the parasympathetic hyperactivity, decreased sympathetic activation, suppress metabolic response to maximal exercise, a decreased exercise capacity, and secondly, we study whether WBC can influence key parameters of recovery to preserve sleep quality and quantity, and also to adapt, interestingly, the food intake to meet the energy demands. The protocol was scheduled in early competition periods starting 11 weeks before the 2012 qualification tournaments for the Olympics. And after 1 week of normal training name-based, the swimmers performed 2 14-day high-intensified training periods named IT in randomized order. One control IT periods during which no specific recovery strategy were applied. It means no hydrotherapy, no massage, no sauna, no steam baths. And also another one include a daily WBC named ITWBC. The two intensified training were separated by 9 days of light training. The HRV, very quickly, the HRV analysis revealed heightening indices of parasympathetic activation after the IT condition only compared to baseline. And this was particularly obvious in the standing position. And after the WBC, however, these parameters did not change significantly from baseline, including the standing position. WBC helps maintain a normal autonomic modulation of heart rate over the 2-week periods of intensified training, even increasing the cardiac response to orthostatic stress. There we are faced with kind of contrasting effects of WBC between short-term and long-term recovery. In acute recovery from maximal exercise, WBC accelerates post-exercise parasympathetic reactivation. It means helps to return to baseline HRV. And In contrast, in day-to-day recovery during intensified training, WBC helps maintain the normal baseline HRV in already well-trained athletes, which is maybe the key points of the discussion. And the mean 400-meter swim speed was significantly lower after the intensified training only in the control group, which is the first step to the overreaching or functional overreaching process. Concerning the salivary alpha amylase, which is a marker of the system, the nervous system sympathetic, and lactate concentration both decrease, but only in the control group. However, using the WBC, these three variables are really constant compared with the base condition. These findings indicates a reduction of a reduced sympathetic involvement and or sympathetic responsiveness to exercise. Since an optimal sympathetic drive is required to maximize performance, WBC may help maintain normal activity, autonomic activity during intense training. And as a practical application, the physiological variation observed at rest and during exercise point to a state of early fatigue accumulation, which is not really overreaching, but not far. We increase only by 20% the training load. Accumulation apparent in IT-con, but mitigated or overall preventive with daily WBC use. At rest, it means upon standing, for example, the parasympathetic hypoactivity and lowered the sympathovagal balance. And during exercise, indicators of a decreased autonomic and metabolic response linked to decreased exercise capacity. Concerning the sleep analysis, with the control intensified training period, there was a significant decrease in the actual sleep time, as you can see here, by about 20 minutes, which could be interesting, Chris and Charles as well. This was accompanied by a significant increase in the sleep onset latency by about 11 minutes. And in the morning, the rating of perceived fatigue was significantly higher after the IT count also, but not really with the WBC condition. Perceived fatigue showed a similar trend than increasing significantly with IT count only. The profile of mood states, which is really important also for the depressive symptoms that I told you already, was not strongly affected as a result of intensified training in the swimmers, indicating again that we are not dealing with a state of overreaching, but an evidence of accumulating fatigue state. The total mood disturbance score obtained from POMS here increased significantly with in the control situation, which is really important, and then decreased with WBC treatments, and then we confirmed the results obviously just showed with the depressive symptoms. Now the last part, it's the energy intake. It means the nutritional analysis, which is a huge part of the study, but I'm going to sum up in only one slide. The nutritional analysis revealed that swimmers did not change their food intake, as you can see on the pictures, with no modification of energy intake from baseline, whatever the intensive period, and despite a 25% increase of the training load, which is a little bit surprising. And using WBC during intensified training, there is no modification of food intake, and these results are in contrast with the one of Alse, who reported finally like if you got an immersion of cold immersion or neutral immersion, you increase the food intake by about 18%. And in our condition, the WBC did not modify the food intake for all the athletes. But it was also the high elite athletes with a robustness of the appetite. Well, then an imbalance also, because moreover, at week 6, we observed a lower leptin concentration correlate with increase of salivary alpha amylase concentration at rest. This imbalance is lower energy stores and higher stress hormones at rest. the practical application could be the following. The daily WBC during intensified training maintains performance after an IT period and prevents the autonomic and metabolic symptoms, announcing an early state of overreaching, which is another one. We need to find a new word for this. Helps preserve sleep quantity and perceived fatigue. Favor end-of-day WBC to benefit from acute parasympathetic boost. Provide by WBC a few hours before bedtime, which is really recommended. Daily WBC sessions did not influence food intake in synchronized swimmer. One question still remains, how to periodize recovery treatments such as WBC, and then which door should be open in priority. Physiological adaptation, acute recovery, the chronic recovery. To conclude, we need then to periodize and to program recovery treatments related to training loads and the seasonal objectives as well. When adaptation is more important than recovery, it means, for example, during mid-season on national champs, for sure there is a kind of green light for active recovery, contrast bathing, and deep water exercise, but not really for the other one. And when recovery is more important than adaptation, it means during workshops, later races, Hakim's told us about the repeats performance. It means when you have to compete 3 times a week. What happened? Of course, there is many green lights. Active recovery, contrast bathings, compression garments, ice baths, and also WBC is then recommended. The question is, does perfect recovery really exist? And I can guess that you can have maybe some answers today, or I hope, at the end of this symposium. With this guide. It's one of the French team in canoe. Now it's the time for acknowledgements, and I would like to thank very sincerely all my PhD students, of course, and all of my colleagues who just work very hard on these recovery protocols, and they try to enhance the performance of all the elite athletes every day. And then if you want to go further on this topic of recovery, you can read next week this book, Recovery for Performance in Sport. Then we edited it with my friend Inigo Murica in Human Kinetics. And now I would like to thank you very much for your attention.
directed in our direction towards Professor Hausswirth with what was a very clear overview of the state of play with regard to whole body cooling strategies. Just while we're about to take some questions and set up for our next speaker, I'd ask you, there are quite a number of empty seats here, so where possible, could you please move towards the centre of the aisle so that we don't have so many people sitting around on the edge of the seat. And we now have time for probably 5 minutes worth of questions before we get started.
Merci.
So if we have any questions, Olaf. So just for the rest of the room, the question was, are there any risks for exposure to the very low temperatures described?
Thank you very much for the question. Really interesting question, because I was invited last year in St. Petersburg in Russia. And the name of the symposium was 25 years background in the WBC choreotherapy in sports medicine. 25 years background. Then, in my opinion, and especially in Paris, in France, we are really precautionous. It means that, for example, we say that at the present time, there is no exposures for the teenagers, but only up to the adult people. And when I asked this question to all the Russian teams, St. Petersburg, it's about 90 whole body cryotherapy centers. It's not 4 like in France, it's 90 only in St. Petersburg. And they've got a background, but concerning scientific production, it's only in Russia, and they don't like to publish in English, they don't speak English as well. And when we try to put this question on the table, they just say, okay, since 25 years, we don't have any troubles, and people from 6 years old to maybe 80 years old just go every time in the cryotherapy chambers. That's my question. But I think we've got specific questionnaires before entering with contraindication, of course. It took about 20 minutes to fill in, and then after you are allowed or not to do this, the exposure. That's it. That's my answer.
Alain? Talk about some protocol, recovery protocols, use active recovery first, after WBC, after contrast water immersion, and after.
Yeah, for synchronized swimming, yeah.
Why you use the last part contrast and no WBC? Because if you use first WBC.
No, we use it separately. It means that each subject have to do one recovery method each week and at the same time of the week. It means we've got a kind of washout of 1 week, but all subjects have to do each protocol and each recovery method. It's not a chronological recovery. They use it only at the recovery, which is really difficult because in fact, it means it's 1 month when you have to program all things for the athlete, including nutrition, including the sleep, and so on. And as you can guess, it's always really difficult to program with the national coaches all the program for elite athletes because we are sports scientists and not really coaches. Even somewhere we are coaches. Yeah, the one I presented on the left side, it's the German one, it's electricity, yeah, only, and the other one is nitrogen gas, which is not really different. And I forgot to present the temperature or the PBC, but it's more cold, in fact. It's minus 160 degrees, and sometimes, because football players, especially the French one, are really crazy, we just put to minus 200 degrees before the Euro. And in fact, the feeling you have when you go out, it's not really the same when you compare the two devices. Because of the cold itself, because the nitrogen gas just came from the from the floor, and concerning the cryo chamber, the German one, the cold air is very you've got a steady state with the cold and dry air, and trust me, 3 minutes is a long way to stay there. Yeah. That's fine. Yeah, we need to increase temperature if it's PBC, I think.
Even WBC,
yeah.
If you're going to do studies above 110, because electric, we've trialed it. As the door opens, I can't see it regulating at 110.
Yeah, for sure.
It goes down very quickly, so the nitrogen gas stays there. And it's just subjective, obviously, because we're in elite sport. We've found a huge difference. We've used it extensively, both with WBC and PBC.
Yeah, that's fine. Yeah, and we were really surprised at the results, and it's interesting because you can use now the PBC on the field very easily, just to put on into a van, and then you can follow all the cyclists or football players or whatever you want. And that's interesting method, I think.
Time for one more question if we have one. Right, then I'll, yes, sorry.
Thank you, Luca.
I have a question about the dose. So, on an individual basis, we have a criteria to establish the dose, like initial body temperature, or is that 3 minutes for everybody?
I've created in Europe a kind of consensus because if you would like to compare things which are comparable, we need to do the same exposure at the same temperature. And now it's 3 minutes for all people use it in Europe. And then we can exchange about data. The Trajocaines just last Sunday in Krakow, which try to put on the table all the results we have, and then just evacuate the duration because it's the same for everybody, and then we compare maybe PBC or not, or WBC, and that's it. Because, of course, previously we initiate some studies about the effect of different temperatures and the effect of different duration. That's a kind of a new toy for me, and I have just to manipulate things with the thermograms and also thermal pills as well. And which is really surprising. I don't know if it is a placebo effect or not, but in fact, 4 minutes, it's a so long way. It means that more than 0.5% of people or athletes would like to go out after 3 minutes. And 2 minutes, it's not so long. Then just don't want to create a kind of discrepancy between duration and then do an average of 3 minutes. And then we've got effects, physiological effects for 3 minutes duration. That's what now we are going on with 3 minutes.
Just have an idea, in the 3 minutes, you use discomfort scale?
Yeah. Yeah, thermal scales, perceived scales, tardiness scales. Yeah, for sure. How much it is? About three units difference between the 4 minutes and the 3 minutes, and more than 50% just let it down. They just go out with the emergency exit. Then we stay that 3 minutes, should be okay. That's fine. Especially also because we are at INSEP, it's a French National Institute for elite athletes, but we are paid for the other people, for all the patients, all subjects would like to just walk normally. That's it, and they have to pay for that. And we have to find exactly the best protocol we can have, and then for sure for all pathologies, like skin pathologies or for psoriasis especially, we know that 3 minutes is efficient. Then we say, okay, 3 minutes is efficient, and they have to do about 15 times in 2 weeks. Then it's a long way. If you stay 4 minutes, it's a so long duration for us.
Yeah, the notion of inter-individual variability strikes me as one that's important. You know, I think of people like myself who have perhaps a little bit more insulation and perhaps the occasional front row forward compared to an endurance athlete who might be down in single figures of percent body fat. I can't see how that wouldn't be influencing if part of this mechanism is genuine cooling rather than the sympathetic response that you're talking about.
Yeah, it's kind of contrasting effects. I don't really know. I think we've got many studies running actually on this, and I'm really precautious actually when we try to have a specific regard on the sympathetic reactivation and intensified training, because it's really contrasting. And I think that when you know about literature about training and intensified training, in fact, we need to have the same exception. Is the reason why the joint consensus of Romain Meeusen is perfect and is correct, because we have to state what is overreaching and what is overloading. Because is it only a training camp of 6 days, like some data we have from studies, which no incidence on performance, and they state that people are overreach, amazing, And then they say, okay, there is an increase of the low frequency, and then the sympathetic, sympathetic activation, hyperactivity after intensified training of 6 days. That's amazing results. And we need absolutely to build protocols with we say that all people are overreached, then you can do measurements of catecholamines or whatever you want about maybe salivary measurements, maybe also the HRV, in order to have a really consensus and convergence of all the data saying that, okay, you can do this, and this kind of overreaching is linked to an increase or a decrease of the sympathetic or parasympathetic tone. That's it. That's my opinion.
Probably a good spot for us to stop. I'd like you to thank